This week on Mississippi Insight, Senate leaders shift gears as they consider how to best expand Medicaid as advocates pressure lawmakers to get it done. We'll hear from them and Senate Medicaid Chairman Kevin Blackwell. Also, there's new movement on proposals to institute early voting in Mississippi, as we'll recap Mississippi's primary elections with an eye toward a big November showdown. That's all ahead this Sunday on Mississippi Insight. I'm Byron Brown. Thank you for joining us for the March 17th edition of Insight. There may be growing agreement among House and Senate lawmakers that expanding Medicaid coverage to thousands of Mississippi workers is a good idea, but getting there will not be a simple process. Senate leaders unveiled a new plan Thursday to let their own expansion bill die on the calendar. Instead, they will seek to revise the language in the House's expansion bill with a strike-all amendment. Now, Senate Medicaid Chairman Kevin Blackwell has until April 2nd to pass the bill out of his committee, and that bill would likely be subject to conference negotiations with the House. The Republican from DeSoto County briefed reporters on this latest plan.
Today we did not take up the bill, so our plan is to let our bill die on the calendar, and then we'll take up the House bill, do a strike-all, and put our Senate language in that bill. The only thing I can say at this time, I think we've mentioned it before, there will be work requirements in our bill, and we'll have more to say as we develop it, but we're still working on the details. Would imagine we'll have a committee hearing sometime middle of next week, and we'll discuss the full bill at that time.
What can you tell us about this sort of strategy, the decision to not take up the Senate bill, do the strike call?
Basically just timing. There's a lot that we're taking a look at, and I think you'll see our bill would be a lot more conservative than what the House put out.
Just as far as the work requirement, anything else you can sort of reveal?
Not at this time, but I know we have said there's going to be a work requirement, so just to emphasize that, we'll still have that.
Do you think it's going to be that 20-hour work requirement, or is this going to be?
Ours, the work, as far as the hours, will probably be consistent with other states that have done this.
I know last time you spoke to us, you said you weren't sure if it was going to be up to that 138% FPL. Anything else you can tell us on that?
I can't right now, but come committee meeting, you'll get all the details.
Have you started to discuss this with your other Senate colleagues?
We have. I think there is. We wouldn't be bringing it up if there wasn't. So.
Any concern about getting something all the way through with the governor's?
Well, I think you have to wait and see the bill, and I think the governor's a reasonable individual, smart man. I think he'll be able to work through what we're trying to do. So.
And work waiver approval is a hard line for y'all, correct?
Pretty much so.
Also Thursday, advocates of Medicaid expansion filled the halls of the Capitol. A coalition called Care for Mississippi gathered physicians, healthcare providers, and others to keep up pressure on lawmakers to advance Medicaid expansion. Among the speakers was Dr. Dan Jones, a former chancellor of the University Medical Center in Jackson.
It's a privilege to represent these people behind me, but a bigger privilege to represent those in the gap, hardworking Mississippians who deserve and need access to health care. Lakin has given you a list of the kinds of groups, the kinds of people who are in the gap. And my favorite group from my early days of practicing medicine in Mississippi are the loggers. People who go into the woods, cut the trees down, and drag those big trees out, and they become paper, and they become furniture, and they become the structure for our homes. And I've known lots of loggers over the years. So let me tell you about one that I met in 1978. The first year I practiced medicine in Laurel, Mississippi. In the emergency room, I saw this hard-working logger in his 50s. He had a dead foot. He had gangrene in his foot. During that hospital stay, he had his leg amputated. He was a logger in his 50s. He wasn't retrained for anything else. This uninsured logger who had diabetes and hypertension, and he knew that he had diabetes and hypertension for more than 10 years, but didn't receive care because he didn't have a magic card. As he said to me, when I asked him why he had not treated his blood pressure and his diabetes, his response was, "Now, Doc, you know us loggers don't have the card, and we can't go to the clinic. And the only place he'd received care over that 10-year period of time that he knew that he had diabetes and hypertension and was at risk of losing a limb, during all of that time, he received care only in emergency rooms, usually when he cut himself with a chainsaw. He deserves health care access. Loggers today, so this was in 1978, and he didn't have access to insurance. In 2024, still most of the loggers in Mississippi don't have access to health care. What a shame. What a shame. So you have heard me say these words before. This is a political imperative, it's an economic imperative, but most importantly, closing the gap is a moral imperative. I call on the ones who are elected, who work in this building, to do their jobs. I call on them to not play politics with the lives of real people who are working hard, who have real health issues. I call on them to settle their petty differences between the House and the Senate. I call on them to make their priority the hardworking people of Mississippi who need access to health care. I call on the leadership in the House, call on the leadership in the Senate. I call on our governor to do the right thing for these lovely, wonderful, hardworking Mississippians.
As a pediatrician, I have seen firsthand the impact of poor health, poor parents' health on their children. Children need their parents, and their parents need to be active, healthy, mentally, physically, and able to engage with their children. I have patients whose parents work sometimes 2 jobs and lack health insurance. I recall a family recently, a mom who worked nights, the dad worked days, so that they had child care coverage for their children since they could not afford out-of-the-home child care, and they had no health insurance. She had a medical issue and she was able to get covered in treatment only because she was in the immediate postpartum period. Once she was past that postpartum period, she lost access to health care coverage and lost access to treatment. These moms, these dads, these families are working Mississippians, and they are moms and dads we need to cover. Mississippi, unfortunately, has the lowest life expectancy rate in the nation at 71.9 years. The national average is 77.3, and Hawaii has the highest average at 80.7. So the men and women in Mississippi are living 10 years, almost a decade less than the people of Hawaii. We need to increase access to mental health, to medical care, so Mississippians can live longer and enjoy healthier lives.
It's worth mentioning again, as much momentum as Medicaid expansion supporters have at the moment, that Governor Tate Reeves remains dead set against such a move. So any bill that does pass both House and Senate will need veto-proof majority support. Another measure gaining traction last week involves early in-person voting. Senate Bill 2580 would allow Mississippi voters to cast their ballots 15 days before Election Day, no excuse needed. Voters can show up to their circuit clerk's office with a valid photo ID, receive a ballot, and submit it, just like on Election Day. The bill does do away with in-person absentee voting, but absentee mail-in voting would still be available. We spoke with the bill's author, Senate Elections Chairman Jeremy England.
They're going to be printed a ballot. They'll be able to vote on that ballot and then actually cast it into the Scantron just like Election Day. Their vote will then be secure in that machine, and it will be tabulated after 7 p.m. on Election Day just like everyone else's ballots. It's going to add to integrity of our election system, in my opinion, for that reason, because one thing that hurts our elections a lot of times is when we're counting ballots after Election Day, the perception is, where are these ballots coming from? Where are these votes coming from? Well, this gets those votes counted on Election Day after the polls close. So it's going to add to our integrity. It's also going to help our hardest working Mississippians out there, the folks that are working shift work and may drive an hour to and from work every day. They might not be able to make the 7 a.m. to 7 p.m. And it's also going to help people who just don't know how they're going to be on Election Day. They don't know what the weather's going to be. They don't know if their children are going to be sick. And this gives them opportunity. As soon as that 15-day period opens, they can go vote at their circuit clerk's office. we see early voting causing issues, or being perceived as causing issues in other states. Our system is very different from what we're seeing in other states. We're not talking about drop boxes. We're not doing ballot harvesting. We're not talking about mail-in early voting. We're talking about just like on election day, you show up in person, you have to present your valid ID, and then you're going to be put into the statewide system, the SIM system, and it's going to say that you voted, you signed the registry book, and you cast that ballot. So that is one way we add to integrity. I think it's also adds to the convenience for the voter, and also adds to the confidence of the voter. When you fill out a ballot and you put it in the Scantron, if there's an issue with your ballot, say if that machine reads that you may have voted for 2 candidates in one race, or you may have skipped a race inadvertently, that Scantron will kick it back out to you, and you'll allow you to correct your ballot at that time. Whereas our current in-person absentee ballot system, once you put that ballot in that envelope and seal it and sign over the envelope, the next person who looks at that, if they see something off about your ballot, it may result in your entire vote getting tossed out, and we don't want that.
That's Senator Jeremy England. His early voting bill now heads to the House. After the break, 2 political analysts talk about the prospects for the November general election. It's Mississippi Insight, only on 12 News. State primary elections last Tuesday did not provide much in the way of drama, but they set the stage for November general elections. That will determine control of the White House and Congress. My colleague Melanie Christopher and I, they talked Tuesday night with 2 experts on election politics, State Senator John Horhn and Magnolia Tribune's Russ Latino.
Any surprises tonight?
Yeah, as we said earlier, just like driving up to an accident where the cops is move along, people. There's nothing to see here. And, no surprises whatsoever.
Yeah, I mean, we've unfortunately, or maybe fortunately, if you're one of the candidates who ends up winning, got into a point where there's not a whole lot of competition in these primary races in Mississippi. So everything was pretty much as expected. Yeah. Obviously, Congressman Thompson easily and unopposed in his district on the Democrat side, and then same thing for Congressman Guest, Congressman Kelly. The only person who had any real competition in the U.S. House of Representatives was down on the coast with Mike Ezell, obviously first time running in 22. Had a couple of opponents in 24, but candidly easily dispatched them. And then there was some interest around the U.S. Senate race with Roger Wicker running as incumbent, but also he was able to prevail pretty easily tonight against 2 opponents. So yeah, the short version is, you're right, there wasn't a heck of a lot of competition.
Not right now.
Yeah, Republicans in the past have always voted Republican fairly strongly in past elections, in particular for supporting President Trump. Anything likely to change come November?
I don't see that happening come November. I mean, if anything, the story of today was very low turnout. That's because there wasn't a lot of competition on the ballot. It's because there's spring break across wide swaths of the state. My expectation is come November, when there's a real race, it's going to be a presidential election, you're going to see very high turnout, both Republican and Democrat, I would imagine.
Yeah, I think all eyes are going to be on the presidential race. Biden and Trump are set for a rematch. There's nothing that is going to change that, I don't think, between now and November. And it's going to generate high turnout. But the interesting thing to me is that I wonder how much more I'm going out to vote against the other guy than I'm going out to support my candidate.
Mm-hmm.
Yeah, I mean, we kept hearing that, right? That the voting public really didn't want to see a rematch of President Joe Biden against former President Donald Trump.
Absolutely.
But their bases sure as heck seemed like they did want to see that rematch. And so here we are, and I do think there's an element of what drives you. Is it loyalty towards your candidate? There certainly is going to be some of that. Yep. I think there's going to be an awful lot of people who are driven by the idea of, I just really don't like that other guy.
Absolutely.
How much is the age factor going to play a role in this, about Biden's age and even Trump's age going to play a role in whether some people do or don't vote?
Well, I think Biden leans into more criticism about the age factor than Trump does. Trump's a little livelier, and Biden's mannerisms kind of lean towards, being criticized and teased about that. But both guys are no spring chickens. So it may play in terms of both their races, but I think Biden's going to get more criticism than Trump.
How about abortion rights? What are we going to see with that? Will that be a factor?
I think it will be a major talking point from the Democratic Party, right? I think if you're looking at the basis that they're trying to gather, they want to be able to win women and win women by large margins. And part of that is that you see some shifts in other areas with voting basis. And so President Biden, as an example, in 2020, won African American and Hispanic voters by over 50 points over President Trump. Current polling shows that he's only up by 10 points in those two demographics. So if Trump is able to close that gap, and that stays all the way through November, then if you're President Biden, you got to figure out who else am I going to go out to make up for the fact that there's a shift underway.
With Ty Pinkins running against Senator Wicker, our senior senator, I think is how we think of him, is he a formidable candidate? I know he's thought well of.
You know, I really like Ty Pinkins. He's a very intelligent, well-spoken young man. He's got some great ideas, but I think the power of incumbency with Wicker trumps that. It may be a competitive race based on what happened in the gubernatorial race back in November, where we had Brandon Presley put on an impressive race, and maybe some of that bleeds over to Pinkins. But I think Wicker's strength of incumbency will win out.
You got to look at the top of the ticket, right? Donald Trump's going to do very well amongst Republicans in Mississippi. He's going to motivate Republicans to turn out, and that's going to feed down all the way into other races. The other thing, to your point, is that Senator Wicker in a lot of ways has assumed elder statesman role. Now, he probably didn't want to hear me say that, but he is he's become sort of the Thad Cochran figure in our congressional delegation. And I think he's looked at as somebody who really knows how to maneuver in D.C. and get things done. I would find it very hard to believe that Senator Wicker was in any real danger come November.
Oh, any surprises that you expect to see come the fall, or even with how the campaigns will look over the summertime?
Yeah, I mean, I think you are seeing shifting in terms of messages. Like, Republicans historically have done well with college-educated folks, with folks at sometimes middle income to upper income. There's a shift in sort of blue-collar messaging that I think Republicans are drawing in more blue-collar folks. I think clearly some of the demographics that I talked about earlier are starting to shift a little bit. So you're seeing some realignment that could be an interesting play. The other question is what happens between now and then in terms of President Trump's legal issues, right? There was a thought process that, hey, if he gets convicted of something, that might impact whether or not he can be successful in the presidential race. I think what I'm seeing is that Republicans are galvanizing. The more legal charges they get brought, the more they feel like their guy's being persecuted. And if that turns out to be the case, then it could actually be to his benefit that the legal system is being used this way.
Well, I think it certainly is being played out to Trump's benefit right now. The more he gets charged, the more popular he gets, and the more money he's able to raise. And the other interesting thing is that there's a statistic running around out there that 1 in 4 African-American males, middle-aged males, and young to middle-aged males may be deciding to vote for Donald Trump for president.
And why do you think that is? Why are black people going towards Trump?
Again, he's played into, I'm being persecuted just like you guys. You know, and
interesting.
And a lot of black guys, you know, rally around that sort of messaging. They relate to the guy.
Very interesting.
There's just one primary race left to resolve in this year's elections. 3 Republicans competed Tuesday for a chance to face Democratic Congressman Benny Thompson in November, and none of them surpassed 50% of the vote. 12 News' Delisha Banks spoke with candidates Ron Eller and Andrew Scott Smith ahead of their April 2nd runoff.
It's time for change, and we need leadership and action. We don't need people that are holding us back as a nation and as a country. Things that we need to look at and consider are like our borders. You know, we see these illegal aliens coming across the borders left and right, and we're putting them and the care of those people above our veterans and our own people, and that's wrong.
Eller also shared thoughts on Yazoo's prison system.
I've seen pictures from inside the Yazoo prison system where there's raw sewage running through the living quarters, and it's been going on for years. This is not humane. We need to, you know, prison's not supposed to be a cakewalk, it's a punishment. but you need to treat people humanely. We need to have positive change in that.
Smith says he wants voters to know how much he cares about District 2.
It is just so devastating to go through and see the ruins of what's left of some of these places, you know, and the people there, it's been a lot longer than 31 years that Benny's been in office. They haven't had a champion in probably 50 to 75 years in that area. And I just want to be somebody who can come in, bring everybody together, be a congressman for everybody in the district, and, you know, move the place forward. This is a winnable race. It always has been. Any race in the world is if you've got the right candidate. The problem that we've had in District 2 with the Republican Party is that, you know, we can't put somebody up there that's just rah-rah and it's making us feel good in the primaries that's not going to win in an 11 or 12 plus blue district.
Delisha Banks, 12 News.
Big thanks to State Senator John Horhn and Magnolia Tribune's Russ Latino for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown from all of us here at 12 News. Make it a great weekend.